we're going to just kind of do a little pinch here, and if you feel anything other than me pushing, let me know. You should feel very little, but if anything at all hurts, just let me know. How are we so far? Anything sharp at all? Good. And we actually don't have to go quite as deep with this as we do with a regular biopsy. We can get away with a little bit more superficial. But the size of it, this is the biopsy punch. It's got to be the standard size so you get a good reading. And then all we're going to do is take that little piece of skin, and we have to pick it up in the right way because we don't want to crush. Again, the epidermis is that outer layer of the skin, and that's what's important here. The rest of it really isn't that crucial, but we got to have that to be able to get a good reading on it. Okay, that is the Zambonis, right? It goes in a solution called Zamboni's solution, and it stays in there for up to 24 hours. Okay, then I'll just need stipticane, betadine, and sylvadine. Got it?
Now it's stuck.
This is such a little piece of skin, sometimes it's hard to see it. There's actually some biopsies that we do that are smaller. If you have a rash, like an athlete's foot infection, we want to make sure that's what it is. We do one even smaller. Okay. So stipticane is just something to stop it from bleeding. Because even though this is a little piece of skin, it does bleed some. That's good. Okay. Just put that on there for a few seconds. Yeah, I would have one recommendation for them is to give us a little more gauze, but I don't think we have any sterile ones in there, do we, right now? We can put it on here if we need it.
No, I don't have any sterile.
Or you know what, give me a Talfa, and that'll be fine, because I'm going to use it anyway for the bandage. And I'll just have you pour some betadine on there. Okay, thank you. So after the stipticane, a little betadine. Good. Okay. And then we'll take a little sylvadine. Okay, and then we can just do it with cling. Now that's just betadine, iodine antiseptic, and there's a little antibiotic cream in it.
Okay.
Thank you. And again, it really only needs this bandage for the first day. Tomorrow, sometime in the morning, just take all this off and then put a Band-Aid over it until the following day. So by Friday you can get this wet. I normally say don't get it wet the first 2 days because it'll be about halfway closed tomorrow. Maybe just one more piece of gauze there. I put a lot of betadine on it.
Well, I have another one up here, so I'll just stuff it.
Okay. And we've got this little spot Band-Aid that they give us. You can use that. And that's basically it. We'll find out. It takes about 2 weeks to get the report from the lab. They've been a little quicker lately. There aren't too many labs that do this. The lab that we use is in Atlanta, and they've gotten a lot quicker now. But when they first started doing these tests, it sometimes took about 4 weeks to get the report back. But I will have her continue you with the Neurontin in the meantime, and then we may add the Metanix once we see what this shows.
Okay.
Okay? All right, that's it.